lançamento de uma parceria histórica.
The launch of a historic partnership among BRICS countries to build a global partnership and tackle socially determined disease is exactly about addressing the most common diseases in the global south, like dengue, malaria, and leptospirosis, as well as the social expression of diseases that also occur in the northern hemisphere, like hypertension, diabetes, and cancer, which sometimes have more severe impacts in the global south.
Now, President Lula has said a few times during this forum that austerity policies can actually hinder development. He was specific to talk about health care when he was talking about that we need money and austerity policies make it harder. Now, how to resolve this tension? Because Brazil is very much concerned about public accounts, as are other emerging countries, and they need to do investment in social issues. How do you resolve this tension?
Dando visibilidade
by bringing visibility to the importance of health. That's why this partnership is so important. That's why the heads of state spent the whole morning discussing global health. So a partnership like this one is also a counterpoint to the idea that health is an expense. That does not exist. We are saying that health is an investment, that countries will cooperate, join forces to invest, to tackle diseases that the Northern Hemisphere has no interest in, because they do not occur there, but they are relevant for other countries, for the global south.
Now, talking more specifically about partnerships with China, both that are happening and potential partnerships for the future, what would you highlight of these last few months and that actually could have been discussed during this meeting here?
We are living a unique moment in Brazil-China relations, starting with President Xi Jinping's visit to Brazil, followed by President Lula's visit to China, which I accompanied. We are building a shared future strategy that brings very important partnerships here to Brazil, including for the production of equipment. And now, during the BRICS summit, we concluded Brazil's presentation to the BRICS Bank for financing a pilot project to build an intelligent, integrated hospital in our country, in partnership with the Chinese, with Chinese hospitals, Chinese research institutions, and Chinese companies. This is a very important project that will not only build a hospital in Brazil, but will also spread the use of artificial intelligence, information technology, and these technological tools to improve healthcare for people throughout Brazil.
And just a last question, Minister. Following the joint statement released yesterday, President of the United States, Donald Trump, said he would punish with additional tariffs any countries aligning with the BRICS principle. How do you see that? Do you think that this statement of Mr. Trump could change the ways that these BRICS countries are behaving, could have any impact on these countries' decisions?
When BRICS leaders announce a partnership like this in health, developing joint projects and medicines, they are declaring their commitment to defending health and life, and showing that for the BRICS, health, life, and science matter. This position of President Trump being against vaccines, against science, against health, was already isolated at the WHO General Assembly, where countries from around the world, Europe, other continents, the African continent, BRICS countries, all positioned themselves in favor of the pandemic agreement, in favor of sharing technology, in favor of investing resources in the WHO. China contributed $500 million to the World Health Organization, showing that there is another path, not the path of the current President of the United States, but a path that defends life, vaccines, and science, which not only BRICS but also European countries and countries from other continents are embracing.